Lyme disease is a bacterial infection carried by a tick. It was discovered in 1975 after an unusual number of young adults were said to have juvenile rheumatoid in a town called Lyme, Connecticut, and several close neighborhoods. The researchers found that the majority of victims lived close to a wooded area infested with ticks. They also found that most cases were diagnosed in the summer, or the height of the tick season.
A closer look at the causes of Lyme disease resulted in the discovery of deer ticks infected with a spiral-shaped bacterium. This bacterium was originally named spirochete and is now known as Borrelia burgdorferi.
In the early stages of the discovery, patients report having a skin rash before they develop the arthritis symptoms. This is called the arrhythmia migrans, which can be a sign in approximately 70 to 80% of cases. It starts as a small red spot that grows over time, forming either a circular, oval-shaped, or triangular rash. It can vary in size from a dime to the whole of a person's back.
Some of the symptoms of Lyme disease include a stiff neck, chills, fever, swollen lymph nodes, headaches, fatigue, muscle aches, and joint pain. Then, as the disease advances, nerve problems and arthritis may occur.
As you can see in this diagram, Lyme disease is most commonly reported and occurring among boys aged 5 to 9.
It affects one's epidermis and dermis cells by causing a skin rash. Next, it affects nerve cells if the disease lasts over a few days. This is most commonly shown through Bell's palsy, which is loss of facial muscle or meningitis. Lyme also affects cardiac cells if it is not treated for several months. Finally, it affects joint and muscle tissues, which is primarily manifested in the form of arthritis.
If one is treated in the early stages with appropriate antibiotics, he or she will usually recover quickly. The antibiotic most used for oral treatment includes dioxycycline, amoxicillin, or cefuroxime acetyl. If the patient has neurological or cardiac forms of this disease, it may require intravenous treatment with ceftriaxone or penicillin.
To prevent the contraction of Lyme disease, the easiest way is to be super vigilant in tick season, or the months of April through September. One should avoid wooded and bushy areas with high grass and fallen leaves. A person can also repel ticks with products such as DEET or permethrin. Use DEET on exposed skin, but be wary of avoiding hands and eyes and mouth. Permethrin should be used on all clothing and can last up to 70 washes. Finally, be sure to remove ticks when you see them on your body and bathe as soon as you return to the indoors.
In 2011, 96% of Lyme disease cases were reported from the 13 states of Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Jersey, New York, Pennsylvania, Vermont, Virginia, and Wisconsin.